Hello, I'm Kip Clark of Ultimate Advanced Bodywork. I'm an advanced clinical massage therapist and specialist in the treatment of chronic pain conditions. And today I'm going to talk to you about rehabilitation exercises and stretches that help pain in the front of the hip, this area here, and also knee problems such as runner's knee, chondromalacia, patellofemoral pain, and lateral patella tracking when the patella tracks laterally, which can cause chondromalacia patella by wearing the cartilage under the kneecap. Right, people who should avoid these exercises, if you've got advanced hip osteoarthritis, it's probably not suitable. Also, if your hip's particularly unstable, speak to a doctor or physiotherapist before attempting these exercises. Right, the first exercise is to strengthen the gluteus medius muscle that's often weak in these conditions, meaning that the balance of the hip and the pelvis isn't right, which can affect the knee and the hip. So, to isolate this muscle, we're going to do leg lifts on our side, but the important thing is to keep the toes pointed down while you're lifting the leg. So I'll just move across so you can see. So the natural tendency is for the foot to turn out as you go up. You don't want that to happen. You need to keep the toes pointed down to isolate the gluteus medius muscle. So only slightly, just make sure that the foot doesn't rotate out as you raise. Okay, so I'm going to have my lower leg bent at the knee, my upper leg straight. And the other thing to watch out for is to make sure as you lift the leg you don't drop the hip back to make the exercise easier and to use muscles that we're not trying to activate. Okay, so I'll do 15 of these. You can start doing 10 and try and build up to 20. Okay, so I'm lowering it smoothly, going up smoothly and down smoothly, making sure that hip stays facing the ceiling and the toes stay pointed down. You can always put your hand on your hip just to stop it dropping back. Again, I'm lifting my foot about 3/4 of a metre off the ground. So, have a brief rest between sets, and then we'll do another set. Do 2 sets of each of the strengthening exercises today. Obviously, I'm exercising the left hip, the left side today. Check your toes, check that your toes aren't turning to point towards the ceiling as you raise your leg. Okay, So the second exercise we will do is to basically strengthen the vastus medialis muscle, which is the medial quad. With the conditions we're talking about, the lateral quad tends to get overly strong, and all the muscle and fascia down this side gets overly tight, whereas the medial quad gets weak and doesn't fire and contract properly. So these are exercises to isolate particularly the medial quad, which is where we want to strengthen, and also it works the gluteus maximus, which again is often weak in these muscles, in these conditions. Right, so with this exercise, what I'm going to do, I'll come slightly to this side. What I'm aiming to do with this exercise, I've got to try and keep the centre of my knee over my second toe, so not my big toe but the one next to the toe. While you're doing the exercise, you've got to make sure that your knee doesn't roll in or out, and also the arch of your foot. Make sure you keep the arch of your foot there and don't let it drop into the side as you do the exercise, but use your muscles to support that arch. Keeping the big toe, little toe and heel in contact, is a good tripod contact with the ground. Make sure your weight doesn't go onto your big toe or your little toe. Keep that tripod there. You've got the back foot, you're up on the ball of your foot, not the heel flat on the ground. And on this exercise, as you're doing the exercise, you want to bring your weight up over the front leg. It's easy to do the exercise pushing with the back leg, but that's not what you're trying to strengthen. You're trying to strengthen here and in the lower deep fibres of the glute maximus here. Okay. Right, so with this exercise I'm going to have my back foot with the toes pointed slightly out on the ball of the foot. Okay, and I'm going to drop down, so I'm bending both knees, dropping down, keeping the hips forward, and then pushing up, making sure I use the glute maximus, like so. I'm raising, trying to almost straighten my leg, and bringing my weight over the front leg here. So, and make sure you're using your left buttock to push up, not the right leg. Obviously, if you're exercising the left side. Okay, and again, try not to move your knee forward or back. You're just keeping the knee roughly in the same place and bringing, as you straighten your leg, bringing your weight forward. Okay, so down. Again, concentrating on using that muscle there and the left buttock. Not put too much weight on the back leg. You can keep an eye on your knee, make sure it's not buckling in or out. To lean forward slightly to keep the weight on the front leg. Check that you've got weight on your little toe as well as your big toe, and you're not keeping your arch isn't dropping, arch of your foot. Okay, we'll just do 10 of those. You might want to start doing maybe 7 and build up to doing about 15. After you've done the exercise, hopefully you can feel that area there, the inside of the knee, feeling quite well worked, and the glute maximus here. So we'll do 2 sets of that, so we'll just have a little rest. Okay, so let's do another set of 10 then. Get yourself comfortable. You're not in too long a stance. You're not in a really short stance or a really long stance, kind of a middle stance. So remember, this knee, that knee's bending, to drop the weight down as well. Keep making sure the knee's lined up with the middle toe, well, the second toe. Okay, so that's 2 sets of that exercise. Right, again, the next exercise is more specifically for the gluteus maximus muscle, which again often needs to be strengthened to help with the balance of the hip and the pelvis and take the strain off certain areas of the knee. Okay, so what we're going to do with this one is we're going to lie down, again exercising the left side. So we'll lie down with the left knee bent and the foot flat on the ground, right leg straight. Get yourself in a comfortable position, spread your arms a little to support yourself. And what I'm going to do here is I'm going to pull my core in, pull my belly back to my spine, tensing my stomach just to stabilise the pelvis and spine. Then I'm going to lift until this is in a straight line here, hip and leg in a straight line. And I'll do 10 of them. Again, making sure your core muscles stop the pelvis battering around. You're trying to hold that nice and steady while you do the exercise. And while you do the exercise, keep your tailbone tucked under. You don't want your pelvis to be tilted forward as you're raising up. Keep that tucked under, like so. Okay. Just have a little rest. Okay. So we'll try and do another set of 10. Again, this exercise you might want to start doing maybe 7, building up to about 15. Pull that core in. Okay, if that exercise is too difficult for you, you can go on all fours. And again, if we're exercising the left side, what you can do is just basically keeping the knee bent and making sure you don't tilt the pelvis forward, curving the spine forward. Try and keep the spine neutral. And you just raise the leg as high as you can. But what I'm not doing is, as I raise the leg, tilting the pelvis and lumbar spine forward, keeping that neutral. So that's an easier glute max exercise if you need one. Okay, right, so what we're going to do now is use a foam roller to release kind of the tight muscles and fascia that will be down the lateral quads and in the front of the hip here, and also up into muscles called the tensor fasciae lata and the glute minimus medius around here. Also we'll be treating painful trigger points, so we can just stop on those for 8 to 20 seconds until they ease. Okay, so what I'm going to do is I'm going to lie over the foam roller with my knee pointed downwards. I'm going to start right up at the knee. Again, I'm supporting my weight and also the position of my body to get different areas of the quad and the iliotibial band. Okay, so I'm going to start just frictioning the area just on the outside of the knee. There's a sore spot there, so I'll just wait on it until it eases. Okay, so just doing a little bit of frictioning. Back and forwards a bit. Okay, so just frictioning. You can just do little rocking movements through the tight or the sore area until it eases up a bit. And again, just hold any bits that are really sore or trigger points, and we just hold our weight and try and relax down into them. Okay, so up a little bit higher. Again, just frictioning that area. And we'll just wait for that to ease up. Okay, so I'm lying on my side now, just rolling up that tight band that comes down the side of the leg, really slowly, try and lengthen it. There's another trigger point, so just wait on that until it eases. Breath in, breathe out, relax it. Okay, so the lateral quad, the outside of the quad, I'm just going to really slowly roll up it here. Only going as I feel the tissue open out and lengthen. Also the body position to keep on the tight area. tie up the iliotibial band there, the band that runs down alongside the bone and the side of the leg. So again, we're just going to roll really slowly through that area, just to actually try and release the tissue and open it out. A little bit of friction in there, so just rocking backwards and forward, just when it feels a bit stuck. Again, do alter your position and your body weight. Make sure you get the problem area as well as possible. So we're actually coming up to the trochanter now, which is the true hip bone. That's this bit here. People often think of their hip bone as this here, which is the front of the pelvis. Proper hip bone is actually here, the trochanter. So we're just working the tendons around the trochanter. Okay, so just come over the top of that hip bone, and now we're dropping into the muscles above it. Tensor fasciae lata runs between the front of the pelvis here and the trochanter. So we're trying to run between these two here. Again, just trying to lengthen that muscle out and stopping on any sore bits and just waiting for them to ease. A bit of friction. Okay, so I'm rolling around now more onto the glutes, more on the inside of that hip bone, coming up into the buttock. Again, just going to roll slowly through the tight areas, wait for the muscle to lengthen. Okay. And just stop on any sore bits and just wait for it to ease. Okay, so we've done some foam roller work there. So the areas we were working were the inside of the knee, from around the side here, down into the front, all the way up the sides of the quads here, and this iliotibial band right on the side here along the bone. And then we're doing the tensor fasciae lata, which runs between here and here, and the glutes, which are around here. Okay, so we'll do some stretching now. So the first stretch, we're just going to do a simple quad stretch. So people often make mistakes with this. So I'm going to grab my front of my ankle. What I'm going to do is I'm going to take a breath in, and I'm going to, when I'm doing this, keep your tailbone tucked under. Don't let the pelvis roll forward too much to take the stretch off the right area. Keep tailbone tucked under, breath in. I'm going to keep the knees together, and then I'm going to pull my heel to my bottom, keeping my knees together, and try and relax into the stretch. Make sure you stand upright, don't lean forward. Okay. Just wait for that muscle to lengthen. And when it starts to lengthen, you can try and move your knee backwards. So now that I'm feeling a good stretch, I'm then trying to move my knee back to the wall behind me to come into a specific quad. We'll do stretches for 30 seconds. Unless they're before sport, then 10 seconds is fine. Okay, again, so you can see that's tucked under, not leaning forward. Okay, we'll do the quad stretch again, but this time we're going to bring the quad, the heel across to the other buttock, because this gets more the outside of the quad. That was more general quad stretch. Now we're focusing on the outside. So another breath in. I'll show you from the back. And this time I'm going to take it across, rather than taking it here, I'm taking it across here. So breath in and breathe out. Pull the heel to the bottom again, but this time you're pulling across. And again, I'm trying to keep my knees together, move my knee back, and try and pull this over across towards the right buttock. Okay, now we're going to stretch the iliotibial band and the tensor fasciae lata muscle, which attaches up to it. So I'm going to stretch my left side. So I cross my left leg behind my right leg. I'm keeping the left leg straight, make sure you don't bend the knee. And what I'm going to do is I'm going to bend my right knee, just to allow my body to drop down, and push my hip out towards the left. I tend to hold above the hip just to support the tissues there. I find that helps. So take a breath in. I'm pushing my hip out. You can, if you need to, have a chair or something to hold on to. Likewise with the quad stretch, you can hold on to something if you're unsteady. I'm trying to feel that stretch all around here. Check that you haven't bent your knee on the back leg. And just wait for it to give. It'll take probably 20 or so seconds until the muscle starts to ease and give. Right. Okay, we're going to stretch the glutes here and the back of the buttock. So I'm going to cross my left knee over my right leg. I'm going to keep this hip on the ground, so I use my heel and my hand to keep that hip down. Breath in, and then I'm just pulling the left knee down to the floor on the right hand side. Trying to feel the stretch around here. you can alter the position of the knee to get the tight areas. So you might want to drop your knee a little further down your leg. You might want to bring it right up over here, depending on where you're tightening the glutes, which muscles specifically. Again, hold the stretch for 30 seconds. Again, if you change position, you might want to hold for another 30 seconds. Okay, so this one is going to stretch the psoas muscle and the iliacus. The psoas comes down from the front of the spine to the inner thigh, and the iliacus comes from the inside of the pelvis down to the inner thigh to the same tendon. So this one, I'm going to go into a lunge with the back knee bent, well, both knees bent, and the foot turned forward, heel up. The other things to make sure you keep your hips forward. Don't let that hip drop back. Keep your body upright, don't lean forward. So, breath in, quite a long stance, heel up at the back, and then breathe out. I'm using my heel of my hand here just to push my hip forward, keeping upright, sinking into the stretch. Keep your tailbone tucked under. Okay, again, I was sinking down as the stretch went further. Okay, the last stretch we're going to do, basically, we'll stretch some of the hip muscles, and again this psoas muscle here. This one, so we're doing the left side, so you have the left knee turned towards the right, and the right knee turns towards the right as well, and yeah, the right foot by the left knee. And what I'm going to do here is I'm just going to take a breath in, breathe out. I'm just dropping my body weight back, but trying to keep this hip down. Trying to keep the left knee down as well. Don't let the left knee raise up. Supporting my body weight on my back hands. Okay, right. I think that's all the exercises for today. So remember, often you do need treatment as well as doing the rehab exercises. Often there's all sorts of myofascial adhesions and trigger points that need addressing, and often you will need advanced clinical massage to help rebalance the hip and pelvis and release all this tissue. Okay. Remember to see a doctor or physiotherapist if you've got any more serious pathologies of the hip. I'm Kip Clark from Ultimate Advanced Bodywork. Thank you.